Hi, welcome to the ChicoBag podcast, a place for inspiration and ideas for changemakers. If you want to leave the world a better place, you're in the right spot. I'm Andy Keller, I'm your host, and today I'm joined by Kizzy Charles-Guzman from the Center for Environmental Health. It's a nonprofit that spent 30 years getting toxic
Mhm.
chemicals out of everyday products. CEH is on the front lines of identifying
Mhm.
toxic chemicals in our products and our environment and taking action to get them out and keep us safe. Welcome, Kizzy.
Thank you so much for having me, Andy. It's a pleasure and an honor to be here with you today.
So I'm aware of some of the work you've done,
Mhm.
but I'd love to hear how you got started.
The origin story. Andy, I'm a scientist by training, and what happened was I came out bright-eyed, bushy-tailed out of college with my degree in hand, and I became went to work for an environmental justice organization. And as part of that, we had a partnership, and I became part of a New York State-wide study that was looking at chemicals of concern in the blood and urine of New Yorkers. And I was part of that study. I'm very young at this time. And lo and behold, I test positive for these things that, in my mind, I didn't even know how they were there, right? So we're talking about phthalates and other kinds of chemicals that exist in our everyday products. And at the time, again, like my lifestyle is very low carbon. I'm very young, so it's not like I grew up next to, a power plant. It wasn't that origin story of like chemical pollution and therefore body burden. So I was just very concerned. I didn't know what this would mean for my future, for my health, for my insurance, right? And I've been working on environmental health issues ever since. I worked in New York City in policy, environmental health, environmental justice, and climate for three different New York City mayors, always leading teams that focused on climate change, climate resiliency, and environmental health and justice. And now I've been at the helm of the Center for Environmental Health for about almost 3 years now, and I'm really, really proud of the work that the team does to keep all Americans safe and healthy.
So it's interesting that you did this test, and you mentioned body burden. I've heard of this.
Mhm.
I'm curious about my own. What is in me? I have no idea. How do you go about getting a body burden test? Is this something that's available to the public?
It can be available to the public, but mostly through initiatives that try to quantify, right? Like we now have a lot more data and information about the body burden that we have. Like the most recent stuff that we're hearing about is microplastics. Many studies, scientific studies, are showing that there's a teaspoon or a credit card's worth of microplastics in our brain. How did it get there, right? And so we have tested placenta blood, we have tested the blood of newborns, the blood of mothers. We're trying to really map out how chemicals like lead, like bisphenols, like phthalates kind of travel from our consumer products to our food supply and then in turn to our bodies. And so I'm not sure how much of these tests are just randomly publicly available. You don't go to a pharmacy and just buy one. But there are many researchers that are working on these, what we call biomonitoring studies. And so it's an area of inquiry for sure. But we also have just a lot of data showing that most Americans have PFAS and microplastics and other kinds of toxic chemicals and endocrine disruptors in their system. We didn't consent to them being there. It's just considered a part of doing business in America, and that is unacceptable.
Yeah, so let's talk a little bit about that. Of course, plastic pollution is near and dear to my heart. A lot of
That's
people
right.
are just learning about this issue.
Mhm.
So can you break down, what are the major toxins that are entering our body? You mentioned phthalates. Where are these things coming from?
Yeah.
And how do we reduce our exposure to these things?
Yeah. So look, over there are about 85,000 chemicals that are listed in US commerce, okay? But only a small fraction of them have ever been thoroughly tested or regulated. And that's because in 1976, a law called the Toxic Substances Control Act, so I'm going to say TSCA just for time's sake, grandfathered thousands of these substances, these chemicals, without safety testing. And very few of those chemicals have been studied for their health or their environmental effects. However, they are often considered essential for certain kinds of products to achieve their intended purpose. So, for example, it's the thing that makes Teflon be non-stick. It's the thing that makes moisture wicking clothing be moisture wicking or fast drying, right? It's the thing that makes certain products repel grease. And so what happens is that we have all of these products that you and I are just buying at a store, right? And if unless we're reading labels, and unless you're in the state of California, which requires right the disclosure of toxic chemicals that are linked to cancers, endocrine disruption, hormonal shifts, all of these health ailments that are widely documented in the literature, unless you're reading for a label, you are just buying leggings. You are just buying soap. You're just buying shampoo, and you have no idea that you are inadvertently putting all the stuff into your system on your day to day, right? So what we are at CH are trying to do is, everything from paints to jewelry, toys, cosmetics, packaging, food packaging, including plastic packaging, that has these chemical products, the bisphenols in your receipts, the receipt paper, all of that. We want to see, we're concerned about these products. We want to see these chemicals regulated, and we want to see them eliminated from the supply chain altogether. So we are a public health organization, and we are supporting government agencies, policymakers, decision makers like consumers, right? So that they can make better choices. But make no mistake, I'm not saying we're going to buy our way out of this. We are policy advocates ultimately, and we want to demonstrate to what we call institutional purchasers. So we're talking about schools, districts, universities, healthcare facilities, government agencies that have to buy large scale of products. We want them to choose safer and healthier alternatives rather than the ones that are toxic laden. Because again, that is how on the day to day, that couch you're sitting on, we're spending our, 90% of our days indoors. We're going to schools and we're serving, like children, in plastic trays that can be coated in PFAS and BPA. These forever chemicals that are highly persistent, that they are going to have this incredibly dangerous effect. And we are seeing already the health effects of all of our lifestyle choices with single-use plastics and many other kind of convenience. And what we want to do is educate the public and advocate for policy both in California and in the rest of the country to make sure that we are achieving transparency in the disclosure of these products, but also that we are ultimately reformulating the products, removing these chemicals from the supply chain. They have no place there. We keep thinking that they're essential to the use, but are they really essential in every single thing?
Yeah, when I think of essential, I think a lot of times this is it's the cheapest option, right? If you want air freshener to smell good, you know, using something that is harmful, a lot of times is cheaper, right?
That's
Am
right.
I correct in thinking air freshener has endocrine disruptors in it?
Many of them are considered unhealthy. There are many types of chemicals that are aerolized. I'm not sure I'm pronouncing that right, but they're because they're aerosols.
Yeah.
They are just ultimately not healthy for our bodies. Um, you know, it's funny. It's not just these optional things. CEH has sent notices of violation to over 30 companies, including major retailers like Amazon and Walmart and Target, because there is a chemical that is cancer causing. It's called Cocamide DEA, and it is in our shampoos and our body wash. So, uh, man, like, I wish that this was just about an air freshener, but it's a thing that you're actually putting on your scalp, you're putting on your skin, and you're going on about your day, right? We also notice companies for lead in sunscreen, BPA in coconut water. So you already made the choice to be healthier and move instead of getting, you know, a sugary beverage, soda. You went to Whole Foods and you bought a can of coconut water thinking you were healthy. The can is labeled BPA-free. And we tested the coconut water and there's BPA in it. Man, are you kidding? Like, why? Like,
Is it
when in the supply chain did it get there? Like, so
that's
we're
that
being
that's
assaulted.
It's scary. And is the BPA from the liner in the can? I understand, the cans have a plastic liner inside them.
So sometimes it can come from the plastic in the can, from the liner in the can. Sometimes is the plastic tab at the top of the can. Sometimes it's neither of those things, but it's rather higher up in the supply chain as we make a product. Like we have found lead in applesauce. There is no level of lead exposure that is safe, especially for young children. So imagine you're a mom and you're feeding your baby applesauce, but somewhere in the supply chain, some machinery caused that. And because we don't have the kind of federal enforcement rules and kind of infrastructure to do product testing properly, right? We are inadvertently feeding our kids and feeding ourselves and putting stuff in our bodies that we didn't actually make a choice to do. You know what I mean? And like that body burn starts to grow over time.
I'm a little bit overwhelmed talking to you because
I,
this is a lot that you're laying down here. Your organization's been working 30 years, doing this. What is the latest? What's on the forefront of your organization? What is kind of most pressing right now for you?
yeah. Look, the one thing I want to address with you right now is let's not get overwhelmed because it is true that we are being faced with many harms. I call them invisible harms because it's hard to see them on the day to day, right? On a day to day basis. Fine, we all just have to do one thing, and we can get into that a little later. But the main thing we have to do is to not get overwhelmed. Rather, if you're going to get anything, then get mad, right? Because there is no place for all of these chemicals in our products. On the day today, we can actually make better choices. On the day today, we can vote with our dollars. On the day today, we can educate each other just by doing small things. And I'm so happy that I'm here because I'm able to share what are those small things and big things that we can also do. So, one of the things that is at the forefront at CEH is, we continue to keep these companies accountable. So again, we're serving notices to companies that we think are in violation of the law, whether those are federal laws or their state laws. Prop 65 in California, we use it to ensure that we are removing the bad stuff from your day-to-day products, whether it's a children's toy, children's clothing, it's your yoga mat, it's your leather fashion accessories, whatever. We are here for you. We are fighting these companies, but we're also educating them. We're collaborating with them, trying to get the toxic chemical out of the supply chain. So we're fighting for you. You're good. We're also advocating for policies that would prevent the harm from happening to begin with, right? We are, again, doing that through consumer education. We're doing that through education of policymakers. We are constantly advocating for the kinds of policies in the state of California and beyond that would protect public health and protect planetary health. So I'm really encouraged by that. So we're doing the thing, and I think that what we want more is for more members of the public to truly support the organizations that are doing this work, because just like CH, there are many other organizations that we are partnering with that are helping us keep governments and corporations accountable, but also working to do partnerships and that really protect the sustainability of our planet.
So, gosh, so I want to dive in a little bit into some of these challenges,
Mhm.
and then the solutions to these challenges. So,
Mhm.
one challenge you mentioned is your receipts, right? So there's BPA in receipts. You know,
BPS, yeah, which
yeah,
is BPA's uglier cousin, I'm gonna say.
BPS, right? So
Yeah.
what's BPS stand for?
Bisphenol S as opposed to bisphenol A. So essentially, they just are a class of chemicals that are very pervasive, persistent in the environment, that take a long time to break down. Here's what you need to know. BPA has been widely studied and outlawed, and then the chemical industry changed one thing and BPA became then BPS. So it's a cousin, right? The problem with BPS is that it's even more persistent in the environment. So you put it in a receipt paper to make it bright white. If I am a worker at a major retailer, I'm handling receipts all day long. And our testing at CEH showed that just handling a receipt for 10 seconds, okay, exposes the person to a level that is above what California would say is the safe exposure level, right, for a chemical. And so here's what we are saying: not everything in our consumer products needs to be um, like, do you care about how bright white your receipt is, right? Can we tell workers and consumers to have the email receipt, to have the receipt emailed to themselves instead, for example? And I don't want to just put it on the consumers. What I want to do is for the retailers, right, to choose the receipt paper that is phenol free, right? So that is missing the chemical that is the thing that is exposing their customers and their workers to harm. So there's always an alternative, right? Like, we don't need the bright white receipt in our hand. We don't need to take it. We can just decline it. And if we're workers, and we actually want the companies to be educated on the toxicity of the material and to do the safer replacement. So that's an
Interesting.
example.
So
Hmm. Hmm.
phenol-free receipts. So in my mind, these are thermal receipts. They're the kind that are printed using heat.
Exactly.
Um, and you're saying there is a phenol-free version of this.
There are. That's right. That's right. And I'm
So
not saying they're great and perfect, but they're healthier and safer. And so we want to move our way ourselves away from the red zone, hopefully into some orange, yellow, while we wait for technology and green chemistry to like catch up with and put health at the center, right? Rather than profit at the center, and get us to that green zone. So we're just taking the position that we don't want to make the perfect the enemy of the good. We want
yes.
to be on the road away from true toxic materials. And so receipts is one of them, but Teflon, black plastic is another one. Wait till I tell you about black plastic, which
Black
most of us,
plastic. So when I think of
oh my
black plastic,
goodness.
I'm thinking of
Yeah.
takeout containers and spatulas. Am I
And
thinking correct?
spatulas and the sushi trays, which again, the reason why we want a sushi tray that is black as opposed to one that is white is that the fish looks prettier in it. So again, it's not even a convenience thing or a cost thing. It's that the black one is going to make your sushi look prettier. But black plastic is highly toxic because it comes from a recycled material that includes electronic waste, which was significantly treated with brominated flame retardants, which again is an endocrine disruptor, is linked to a variety of health issues. So, in theory, sounds good. It's recycled plastic material. But is there such a thing as healthy or safe recycled black plastic? And so what we want to do is to ask people, well, avoid these kinds of things, but we all need to get our takeout, and then that's fine. Just don't reheat your food in the microwave in the black plastic. Don't store it in the fridge in the black plastic. Once it gets to your home, move it to a glass container, put it in your plate right away. Again, many behavior shifts that we can think here about to kind of reduce our exposure without becoming grossly overwhelmed that everything is trying to kill us.
So the black plastic, if it has recycled content in it, you're saying there's electronic, waste and the residues from that. How is this out in the market given these things that you're saying?
You know, um, that is a great question, Andy, and I don't know. I think that if our bedrock environmental legislation and public health laws ultimately put prevention at the core, and we had to demonstrate that chemicals were safe rather than um, hoping that they
Yes.
are not toxic. You see what I mean? Like, if we truly had what used to be called the precautionary principle as the way that we think about our products, right? We wouldn't have grandfathered 62,000 plus chemicals onto the market without safety testing.
And this is
We
what
would not, you know what I mean?
Yeah, and this is what Europe does. They use the precautionary principle where you
That's
have to
right.
prove it's safe before putting it into the market. Whereas in the US, we put it into the market and then you have to prove it's not safe to get it out of the market, right?
That's exactly right. And so most chemicals in these consumer products have never been assessed for safety by any government agencies up to organizations like CEH. to go to the Whole Foods and get the coconut water can that's labeled BPA free and then bring it back to our office and test it and then send it out to a lab and then and be able to show then in court that the coconut water is laden with BPA even though it's mislabeled. You see what it like, oh my God, it's a it's I don't think it's right. And many people are trying to do the right thing. Ultimately, it wasn't between 1976 when I mentioned that TSCA was first passed and it grandfathered all those toxic chemicals. It wasn't until 2016 when a new law was passed to improve it, right? And yet, right now, that's one of the greater challenges that we are facing, which is that we are um, this current Congress is exploring proposals from the chemical industry and beyond to reopen and renegotiate the TSCA law, the original, legislation. And there are many sticking points that about how they want to treat state chemical laws that are safer than what the federal government has in place, right? Whether these chemicals would be reviewed for safety, whether the existing law would do more to protect public health. So, like, this debate is currently in full swing in Congress. And those of us have been working on protecting TSCA, as crappy as it is, you know what I mean, for 2 decades. We're worried about it because now more than ever, we have a Congress that is very friendly to the chemical industry that is putting profit over people's health.
So
So
yeah, so that's a huge challenge, right? To
it is a
to
huge
roll
challenge.
back the minimal
Exactly.
safety net that we already have in regard to the chemicals is heartbreaking. What's the solution to this? How can
Yeah.
people get involved in that?
Yeah, that's a great question. Look, here's the good news: the federal government's environmental policymaking is over here, and then there are many states, and I'm very encouraged by many states that are doing more to protect the health of their residents. And then there are cities that are doing even more progressive, even more health protective policies. So, one critical thing is to make sure that we are continuing to push our local and state officials, supporting them, right? To make sure that we can hold the line on keeping, right, um, our state and city policy making safe and protective of our planet and our bodies. So that's one thing. But secondly, we want to make sure the federal elected officials are not just weakening the state's abilities to make those decisions and to make those choices and to push really good work. So for you and I, what can we do? Well, the organizations that are engaged in this fight every day, holding the line, holding corporations accountable, bringing very critical information to the general public so we can make safer and healthier choices. Bring in that same information to our elected officials so that they understand what's at stake, so that they can, vote in the ways that help protect public health and planetary health. Like, that's what we need to do. We need to come together to be creative as to how we fund the critical work that these environmental organizations are doing, like CEH. How do we double down to support the movement that has taken us so many years to, you know what I mean? To, like, these achievements, we don't want those achievements rolled back. We want more protective. We want more protection of our health, not less. And so, I really think that funding and supporting environmental work, continuing to educate our kids and each other about the things that we can do, the ways in which we can participate, is critical. We cannot let up. We cannot risk losing 3 decades of environmental and public health progress because guess what? Our chemical industry, they're doubling down on their investments, their efforts, their attacks. You know what I mean? Like, so why would we take a seat back just because we're overwhelmed by the gross, amount of information that we now have, during this time?
It's an excellent point because really nonprofit organizations like the one you're running are, in my mind, the only organizations that really can do the work,
That's right.
because the politicians, have lobbyists and campaign donations that are impacting, their clarity in the
Hmm.
issue. Companies, have profit motives that, even though they know what might be the right option, a lot of times it's more expensive, frankly, and there's not a real a big incentive for them to do it without proper policy in place, right?
Yeah, yeah, I think that's right. I think ultimately, um, it feels cheaper because the cost is being borne by consumers like you and I,
Yes.
right? Like no one would say that healthcare in those countries is cheap, my friend, right?
No.
So, and so everything that we are facing from, like, how many of us have someone in our lives that is facing cancer, infertility issues, grappling with reproductive health issues like fibroids, grappling with endocrine disruption or even developmental issues. Like I feel like it's almost all of us that have someone in our families that for whom this is not just costing them significant amount of money, but it's also costing them their productivity, their quality of life, their ability to participate in our democracy and our economy, right? Like you really just can't have a thriving economy and a thriving democracy without a healthy body. And so for sure, like when we say like, well, things are cheaper, well, it's cheaper for some segment, right, of a profit making enterprise, but it's not cheaper for us as a society writ large. And so, listen, CH is going to continue fighting to safeguard human health
Yeah.
and our environmental health because we have got to keep toxic chemicals out of our water, air, soil, food, and our bodies. It should not be that the thing that I'm breathing is the thing that's killing me. Why? Why? There's so many other
Exactly.
things. Like, what? Like, it's my most inherent right is to breathe air, is to drink water, and you know what I mean. Like our food is grown in soil, our oceans sustain our whole planet, and our way of life. Like so. Anyways,
So how can people connect with you and follow your work and support the work you're doing?
I appreciate that question. Follow us. We are on social media. We are on TikTok and Instagram and YouTube. But start on our website just because we're ceh.org. That's the thing for me to say. We're the Center for Environmental Health. LinkedIn, email me and kizzy@ceh.org. We're here to answer your questions, to catalyze your ideas, to receive your support. I think again, it's really critical. What we're seeing in our movement is a lack of focus, or rather, let me rephrase that. We are seeing our longtime supporters have a very split attention now to many other challenges that are present at this time, right? We are worried about democracy. We're worried about our civil liberties being eroded. We're worried about many things now. And so, if before our supporters were giving to environmental health causes, now they're giving to many more causes. Therefore, we are all weakened together in a way. Does that make sense?
Yeah.
So, we cannot survive and get to the next level of environmental protection. We cannot hold the line if our supporters are turning their back on us. And um, again, I don't see the chemical industry letting up. They're doubling down their efforts. So it is time for all of us to get rid of the black plastic utensil in our kitchens. All of us to choose reusable products instead of a single-use disposable straw or cup or plastic product at some point. Like pick one thing, pick one bottle in your home that you have, that you can wrap your brain around rather than becoming overwhelmed. And then make sure that you support that environmental organization of your choice. Hopefully it's CH, but there are many others that are doing just great work. And we need you. We need your voices. We need your tweets. We need your networks. We need your donations. We can use your energy. I think we only lose when we drain all Americans of their energy to participate and to demand and to hold the line on accountability and on environmental and our health protection. So think of your water, your air, your soil. Nothing else matters without that. The earth
Yeah.
sustains us, right?
Yeah, and your
So it's
and
all
your and your loved ones, right? So the people in your life that may be suffering from cancer or other types of diseases that are related to the toxins in our environment.
that is
Um,
correct.
yeah, so
That's right.
a lot of people raise money for cancer research, to fight cancer. However, really, to think about it, holistically, the money needs to go upstream to stop the chemicals from entering our environment. So
That's
if
right.
you I would encourage anyone listening, if you do have family or
That's
friends
right.
that are suffering from cancer, a donation to CEH would be a great way to honor your loved one.
Oh, I appreciate that, Andy. That's right. I wish that we could have a world without these environmentally related and, in my mind, preventable health outcomes. Not just cancer, everything from, again, developmental issues, from ADHD, uh, diabetes, cardiovascular disease, respiratory disease, all of those things, air pollution, water pollution, plastic, all widely documented in the literature. And that's why we're so proud at CES to be a science driven, science backed organization. We're not making this up. We're coming to all of our, to the public and our elected officials with data. We're saying, here's what's in our products. It doesn't belong there. Here are the scientific studies that show that our fertility rates are declining with the rise of microplastics in the environment. Here's the data that shows that policies like Prop 65 have resulted in a lowering in toxic chemicals in the blood of all Americans, not just Americans in California. And that's because once you have a protected policy like Prop 65, guess what? A company is not making a product to sell in California that's different than the product they're selling in New York, right? They are cleaning up the entire supply chain. And in the process, we're making Americans healthier. And so, yeah, we need your support. We need your voices. We need your energy, your momentum. Come to us.
Kizzy, thank you so much for sharing your wisdom and inspiring us on the podcast. Thank you.
Of course. Thank you for having me, Andy. I really appreciate the work that you do and the amazing awareness that you brought around the issue of plastic pollution. I just always love seeing this background and your and when you wear it, even though it looks a little hot, it is also just shockingly impactful. So thank you for your work and your advocacy in the space.
You're welcome. Thank you.
Yeah.